We've been getting quite a few questions about testing in Cumberland County Health Department. We'd like to offer an answer to a few of your questions. So based on guidance from the Centers for Disease Control and Prevention and the North Carolina Department of Health and Human Services, we know that not everybody needs to be tested. In general, patients that don't live in group settings and have mild symptoms that don't progress do not need testing. They should stay at home and recover. When you leave your home to get tested, you could expose others to COVID-19 if you don't already have it. And if you do have COVID, you can give it to others. So there's no treatment for COVID-19. A test won't change the course of treatment that your provider will recommend to you. We're going to ask you to stay home even with a positive test. Testing is most important for those that are seriously ill in the hospital or people in a healthcare setting or in a high-risk setting like nursing homes or congregate living settings and other first responders. We're prioritizing testing for individuals based on guidance from the Centers for Disease Control and Prevention and the State Health Department, and for those that meet those criteria. This includes patients with symptoms who are in high-risk settings, congregate living settings, long-term care facilities, and for healthcare workers and first responders, EMS, fire, law enforcement. And we're doing that on a case-by-case basis. So we need you to call us first for an assessment and screening. You can call 910-433-3655 or 910-433-3645. Testing will take place at Cumberland County Health Department on our grounds outside of our building. That helps us avoid unnecessary exposure to other members that are visiting us at the health department and our staff. We'll have test collection available on a daily basis in the morning. And again, if you meet those criteria for testing, we need you to call us in advance for assessment and screening. And again, that phone number is 910-433-3655 or 910-433-3645. No, we cannot accommodate walk-ins, and that's in order to protect health department staff and our patients. We do not allow walk-in testing. For those that meet criteria for testing, you should call us in advance for screening. This allows us to prepare your paperwork in advance and for us to give the patient important instructions about isolation. That limits the time that the person is outside of their home and limits exposure to our staff and to the public. Mild symptoms are defined as fever and cough without any of the following: shortness of breath, difficulty breathing, chest discomfort, altered thinking, or bluish face or lips. So if you don't have any of those and you only have cough or fever, then your symptoms are considered mild. If you have emergency warning sign symptoms, including trouble breathing, we want you to get medical attention right away. Call your doctor or 911 right away if you have shortness of breath, difficulty breathing, chest pain or pressure, confusion, or blue lips. Tell them about your COVID symptoms and any potential exposure to COVID-19. We want you to check off 3 things. You can stop isolating yourself when you answer yes to all 3 questions. Has it been at least 7 days since you had your first symptoms? Have you been without fever for 3 days or 72 hours without any medication for fever? And have any of your other symptoms improved? Call your doctor if your symptoms get worse or if you have any concerns about your health. We'd encourage you to visit the Centers for Disease Control and Prevention website. There they have steps for what to do if you are sick. These steps can be found on the website. In general, we want you to stay home to get medical care, separate yourself from other people in your home. This is known as home isolation. We want you to call ahead before visiting your doctor if you need to do so. If you're sick, we want you to wear a face mask in the following situations. If you're sick or you're caring for other people that are sick, we want you to cover your cough and sneezes and clean your hands as much as possible using soap and water or hand sanitizer. We want you to avoid sharing food and other personal items that are in your home. If your symptoms worsen, we want you to call your doctor right away.